ladies and gents. Here on LLU 2014, there's a new type of alternative therapy called hydrotherapy. Hydrotherapy is the use of water as a medical treatment. Water can be in the form of water vapor, steam, liquid, or ice, and can be either taken internally or used externally. The origins of hydrotherapy has been used throughout history by many diverse cultures, going back from ancient Rome, ancient Greece, and the Old Testament as a healing agent. The modern use of hydrotherapy is linked to Vincent Priest, who established the Grafenberg cure in the 1800s for almost every ailment. This treatment involved the use of water in every conceivable way, alternating between hot and cold water. The primary purpose of hydrotherapy is to soothe sore, inflamed muscles and joints, rehabilitate injured limbs, lower fevers, soothe headaches, promote relaxation, and treat burns and frostbite, ease labor pains, and clear up skin problems. Now going to Ivana Martinez out on the field doing some interviews. Now to her.
Good afternoon, ladies and gentlemen. I'm here at the Hydrotherapy Clinic, and I have Leah, who's going to be presenting some cost information to us.
Hi, I'm a therapist here at the Hydrotherapy Clinic. Here we offer a constitutional hydrotherapy, which is a form of contrast hydrotherapy that increases circulation of blood and lymph to the contacted skin, tissues, and throughout the internal organs. The increase of circulation improves metabolic function, detoxification, immunity, healing, and vitality. By improving these fundamental functions of the body, greater quality of life can be experienced. Here at the Hydrotherapy Clinic, we offer 45 to 60-minute treatments. You can purchase a 60-minute treatment for a single price of $75. We also offer different series of treatments if you want more treatments in one session. We offer a series of 5 and a series of 10. The series of 5 costs $60 per visit with a total of $300. The series of 10 visits is $57 per visit with a total cost being $507. Those are the costs.
All right, sounds very good. Thank you very much for that information. All right, and guys, I've actually done some research as well, and I found 2 different articles regarding hydrotherapy. The first was a 2012 systemic review by Al-Kabesi, Fatoy, Goodwin, and Johannes regarding the effectiveness of hydrotherapy in the management of rheumatoid arthritis. And of those 197 articles that they actually found, 6 of those studies were used, and it was found that hydrotherapy in comparison to no treatment showed that there was a reduction in pain, joint tenderness, mood and tension symptoms, and increased grip strength and overall improvement in patient satisfaction. The second article was a 2009 meta-analysis by Langhorst, Musal, Klaus, and Hauser regarding the efficacy of hydrotherapy in fibromyalgia syndrome. 10 randomized controlled clinical trials met the inclusion criteria for this study, and it was found that a moderate reduction of pain and improved health quality was improved for these fibromyalgia patients. Now I have Adriana here, who's going to be explaining to us a little bit of why this hydrotherapy as an alternative therapy is going to be recommended and why it's not going to be recommended.
Hi. Thank you for having me, Ivana. So why do you think hydrotherapy would be recommended? Well, it has many benefits. For one, it's usually prescribed for people to have self-care in the home. You know, if other type of regimens weren't really working for them, or the typical Western ones weren't working, they could try this and maybe that would be more compliant for them. Some of the benefits includes like the dramatically increasing the elimination of waste. It helps detoxify the whole entire body. It loosens up tense and tight muscles that we get sometimes, encourages us to relax, and kind of just soothes the body. It also increases the metabolic rate and the digestion activity, so it helps move things along if things are getting a little bit slow in there, and helps hydrate the cells in our skin and our face. And so we know that women today, we like nice, beautiful skin on our faces, right? So this is one way that can definitely help get you that. It also helps boost your immune system and keep you from getting sickness. And it helps just your body to function more efficiently together. And it improves the function of your internal organs and helps stimulate blood supply. But some things that we wouldn't recommend hydrotherapy for is for certain people like of age extremes, say really young or they're really, really old, they probably wouldn't be able to handle the cold baths as well. Or for those who have any heart conditions, we wouldn't recommend hydrotherapy use of any type of sauna, just because we wouldn't want to aggravate any type of further heart problems. And also vigorous use of water jets. So if you have any type of fracture or osteoporosis, or you have a known blood clot, we wouldn't recommend that for you, just because that could cause further fracturing or, let that blood clot go, and who knows what could happen. So there are some goods and some bads, but I definitely would recommend it if your doctor says it's fine. Yeah.
All right, thank you very much for that information. So I've actually been informed that Leah just received her first patient, Jessica, so we're going to be going off to them, and they're going to be showing us some exercises that they're doing here at the hydrotherapy clinic. So here's Jessica and Leah.
Hi, we're here with Jessica. She's a professional tennis player who's here for some sore muscles. We're going to get started working on her lower legs. Going to do your stretch out first.
So as you can see, they're very hands-on here at this hydrotherapy clinic, and we just want to say thank you to Leah and Jessica for allowing us to film them, and I'm Ivana Martinez with LLU 2014.